Hello, welcome everyone. Radiologists face few challenges in their daily practice. Okay, so let us see. Question is, how can we avoid typing errors in the report? How can we reduce the patient waiting time? How can we reduce dependency on the typist? And how can we increase the reporting speed? Include detailed fetal medicine risk in the report, save time and reduce stress, and do advanced reporting like TIRATES, BIRATE, and iota adnexal risk, and include those in the report. Okay, so let us see the drawbacks of the manual reporting. See, sometimes typists may come late or they are absent, or in case they have come but still there can be typing errors. For example, if some measurement is 4.2 and if they forget to type this dot, it will become 42. And sometimes if they get confused in the unit, let us say there was a 5 mm kidney stone, and in place of mm if they type centimeter, it will be a wrong. And sometimes let's say one patient's measurements and abnormality can be typed into the second patient's report. I mean, this can happen once in a while. So we have to be careful because patient's life and time is precious. So how can we address those challenges? So to make the center more systematic, you can ask few questions. For example, what is the average time taken in your center to type one report? Are you taking 5 minutes, 4 minutes, 3 minutes, whatever it is? Okay, you are the best judge. And average number of measurements in each report, I mean, okay, various sonography can have various report. Anomaly can have large number of measurements, abdomen can have less measurements. Okay, so and what is the average number of abnormal lines you dictate or type into the report? I mean, in the conclusion, 3 lines, 2 lines, 4 lines. And average patient waiting time before their USG turn comes, and after USG, the time to get the report. Okay, and the number of typing errors per year. Okay, so now let us see what exactly how is the radiology workflow. Let's first understand it, and then we can think where we can improve it. Okay, so the patient sonography machine acquires the images of the patient, and radiologist sees those images, and from his sophisticated brain he or she finds the diagnosis. Okay, after the diagnosis he finds, either he conveys to the typist, then typist types into the computer and they print the report, or doctor might type himself into the computer and the report is generated. Okay, so this is the main area where we want to focus to. After the diagnosis is found in the doctor's brain, we want to avoid the errors and increase the speed. Okay, so let us see how can we do it. So question is, can we automate the report typing and reduce the dependency on the typist? So basically, radiologist's brain has lots of medical knowledge in it, and what you are currently doing, every time a abnormal patient comes, you search your brain and bring the relevant information for that particular patient from the brain and type it into the report, or you tell your typist to type, or you copy paste from your predefined short keys or some word template. Okay, so the question is, so much knowledge in your brain, can we program all this knowledge in a computer, so the computer can create report automatically for you with a minimal manual input? Okay, so answer is yes. I mean, thanks to touch panel in your USG machine, basically it's, you can simply program abnormalities in pCare, and pCare can auto generate report for you. Let us see how. Okay, so it has a programmable reporting. So for each organ and for each abnormality, you can predefine your statements and the conditions basically. So let us say for kidney, in kidney if you annotate B or C, then this bilateral renal calculus description will come into body of your report, and this line will come into your conclusion of the report. And here you can specify the formatting also, what kind of formatting you want in which condition. Okay, now let us see few case studies. Okay, so here right kidney has a calculus, doctor has annotated it with its measurement 5.3 mm. So you can see this 5.3 mm calculus seen in right kidney has come up automatically here, and even the 3 dimensions of each left and right kidney has come up, and in conclusion also the calculus size and its description has come automatically. Now let us see second case study. Here the doctor has annotated fatty liver and grade 1. Okay, so that grade 1 fatty infiltration of liver has come up automatically. Okay, and the 3 dimensions of the right and left kidney each has come up. In uterus, doctor has annotated adenomyosis, and there is a posterior wall interstitial myoma, and with its 2 dimension, basically fibroid. So the 2 dimensions of the myoma with its description posterior wall intestinal myoma has come up, and 3 dimensions of the uterus, and this adenomyosis description also, the coarse micronodular ecotexture has come up in the report, along with the endometrium measurement also, and the ovary 3 dimension and its volume. And you can see in the conclusion also it has nicely written the size of the fibroids with the posterior wall intestinal myoma. Okay, and even adenomyosis description has come in the conclusion, and the fatty grade 1 infiltration of liver is also come up. No need to type any single thing in your report. You can program, if you program your templates nicely, all this will come into your report automatically. Okay, so let us say in this case study doctor has typed LUVJ edema. Okay, so corresponding to that, in the uterus section it has automatically typed the mucosal edema of left uretrovesical junction with hydroureter proximal to it. And in the second image, left ureter lower third portion doctor has annotated. Okay, so corresponding to that, there is a calculus seen in distal third portion of left ureter with hydroureter proximal to it. That has come automatically. Apart from this, 3 dimensions of each left and right kidney, and in the bottom impression the mucosal edema line has come up in the report at the left uretrovesical junction. Okay, and suggestion to correlate for the post calculus passage gravel edema, and even the calculus seen in the distal third portion of left ureter with hydroureter proximal to it. It has come automatically in report nicely. Okay, let's move to the next case study. Here there is a retroverted uterus, so doctor has annotated RV, so corresponding to that, it software has automatically wrote the uterus is retroverted. Okay, then there is one fibroid in the anterior wall subserosal myoma 1 and its 2 dimensions. So this line with 2 dimensions anterior wall subserosal myoma has come. There is a second fibroid anterior wall subserosal myoma 2 dimension. So you can see here there is a this dimensions size anterior wall subserosal myoma seen in uterus. Okay, and again there is a, in this case also there is adenomyosis. Okay, so that line also shows coarse micronodular ecotexture has come up. Apart from these 2 ovary dimensions and the volume of the ovary, and in conclusion also adenomyosis, the dimensions of the each fibroid and its description has come up automatically. Okay, next slide, you can see doctor has annotated right kidney hydronephrosis grade 1. So corresponding to that, in your report grade 1 hydronephrosis on right side has come up, and in second image the calculus is there in the right kidney which is dimension 5.39. so it has rounded, it can even round off your measurements also. Let's say instead of 5.39, many doctor don't want to write 2 decimals after the 2 digits after decimal, they only want 1 decimal, so it is rounded to 5.4. There is a 5.4 mm size calculus in right kidney, and again in the left kidney also 6.62 mm calculus is there, so that also 6.6 mm calculus in the left kidney has come up. 3 dimensions of each left and right kidney, urinary bladder 3 dimension and its volume for prevoid and postvoid has come up automatically here. Uterus 3 dimension, endometrium, even ovary 3 dimensions and its volume for left and right both, and in the conclusion again grade 1 hydronephrosis, calculus in the right kidney and its dimension. Similarly for the left kidney also it has come automatically. Now can you imagine, can you guess how many measurements this report has? Okay, so let us see how many. So it has total 27 measurements. Here the breakup is given. The right kidney has a calculi and 3 dimension, left kidney same, prevoid 3 dimension and volume, same for the postvoid 3 dimension of the uterus, and the 3 dimensions of the and the volume of right and left ovary. So total 27 measurements software has brought automatically, along with its abnormality and along with its formatting. If you closely observe na, whatever abnormal lines na, it has wrote it in the bold. Okay, so in this software you can even program the for which kind of formatting you want in which condition, that also you can specify. Even in the conclusion you can see the text has come in all capital letters, so you can, if you want it italics, underline or bold, whatever you want, that can be programmed. Okay, so you can guess how many minutes this can save per report and how much typing errors it can eliminate. Okay, now let us see next case study. There are three calculi in the right kidney. These are the three measurements of the each three calculi. So this has come automatically here, three classical calculi of dimensions of each calculi, okay, in the right kidney. And in the next image there are four calculi in the left kidney, so that also has come up automatically, all four dimensions. Apart from this, three dimensions of each left and right kidney. Urinary bladder, three dimension and its volume for the pre-word and the post-word has come up automatically. Prostate, three dimension and its volume. And again in the impression, three calculi in the right kidney with its description and the measurement. Similarly for calculi in its measurement for the left kidney. And the bladder wall hypertrophy, in some other image doctor might would have annotated this, that's why it has come up here in the report, last line, bladder wall hypertrophy. Okay, everything automatically. Can you again guess here how many measurements in the report? Okay, let us see how many. Okay, there are 25 measurements in this report. You can see the breakup here. So definitely it will save you a lot of time and it will eliminate typing error and it will reduce stress for you and the typist and help the patient definitely. Okay, now let us see see a case of a chocolate cyst. Here doctor has annotated chocolate cyst in the right ovary and two dimensions of that chocolate cyst. So you can see in the ovary two dimensions and the description of chocolate cyst has come up. Ovary three dimension and its volume for right and left each, and in uterus three dimension and its volume, and endometrium measurement has come up automatically. And in impression also it has written the measurements of the chocolate cyst and its description nicely. Okay, now next, so similarly even if you are doing upper limb arterial, lower limb arterial, or a carotid Doppler or a renal Doppler, for example this is a case of renal Doppler. So if you are measuring the Doppler measurements at origin, hilum, accessory origin, accessory hilum, and upper, middle and lower segmental then it can read those automatically and show a nice report like this for each kidney separately. Apart from this, it can bring the measurement of peak aorta velocity also, and other dimensions of the kidneys and etc. Pre-word, post-word in the renal Doppler. Okay, so and here in the fetal, it has a very sophisticated fetal medicine module also, where it can compute the Barcelona Doppler risk with its percentile and pathological or normal result from Barcelona website. It can compute the Z-score and percentile from FMF UK website also. It can compute the MCA PSV anemia risk, okay, medium, mild, moderate, severe, and along with the mom value also. Okay, and it can show you the biometry with this percentile and even the ratios here. And in the 0 to 40 week scale we are showing the average sonography age and average age by LMP by this black and blue triangle. One triangle is pointing upward and one is pointing downward. So just by looking at these two triangles, your gynecologist can quickly come to know how much is the discrepancy between, how much is the lag between age by LMP and sonography. Okay, apart from this, it can bring this, see whether it's a cephalic or a breech, placenta anterior or a posterior, and its grade, amniotic fluid value, and whether it's an oligo or polyhydramnios or it's a normal range, or even if it is less than 4 then severe oligo. Those kind of things it can bring automatically into your report. Even cervix length it can bring. Okay, now next is it can show you this growth history graphs also into your report automatically. And if the patient has done the previous sonography in some other center, and if they have brought those reports with them, you can even enter those previous measurements in the software. So your software can club those measurements and show you the growth trajectory graphs also nicely in your report. Okay, and even in second trimester aneuploidy genetic soft markers are there, right? So even for those also you can specify which markers are absent and present, and from there it can compute the trisomy 21 risk, and it can show a nice tabular format in your report. Okay, apart from this, it can compute preeclampsia risk. It has a gestation age calculator, FMF growth restriction, first trimester trisomy 21 18 13 risk from FMF UK, FMF biometry percentiles, perinatology skeleton percentiles, FMS small for gestation age, FMF Doppler percentile and Z-score, Barcelona fetal growth restriction, Barcelona Doppler percentile, and even perinatology, pulmonary airway malformation ratio, volume ratio, it can compute and show it in your report. Even left lung hernia, right lung hernia also. Okay, so these are various fetal medicine features we have. And apart from this, it is an advanced reporting module also. For example, if you have done thyroid and you want thyroid score, then you can specify the composition, echogenicity, shape and margin, etc. from here, choosing the radio button, and it will compute the score. And you can even add multiple nodules and specify whether it's in left or right, etc. Okay, and it can bring these things nicely into your report also. Apart from this, we have integrated IOTA adnexal risk calculation website also from IOTA international body. You just have to give the diameter of the lesions and maximal diameter of largest solid part and few other input parameters. So it will put all these parameters to the IOTA website, and whatever these graphs and the percentage risk they give na, that will come into your report automatically nicely like this. Okay, apart from this, even you can compute the USG birate risk also. You have to specify tissue composition, mass, calcification, etc. And you can specify the what birate score you want to give, and it will come nicely into your report. And apart from this, we have many small supporting features like auto PNDT feature to file the PNDT online website automatically. At reception entry, it can show automatically in your sonography machine. You don't have to re-register patient in the machine. It has a full accounting billing module also, plus it has a DICOM printing module also, plus fetal medicine module we have already discussed. It has a teleradiology and pathology as well. Okay, and it is a very nice accounting billing with the WhatsApp feature also. You can WhatsApp the report and the images to the patient and referring doctor also. Thank you so much for your time and patience. We appreciate it. Thank you so much.